Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Well, hi there, Dr. Darrow.
Yes, I am living it up.
Well, we just got to that right away, didn't we? And
but I want to ask you a question.
Sure.
Well, actually, you can ask me a question. Go for it.
Oh, I thought you were going to ask me if I was also living it up. I am.
Yeah,
I learned it from you. Yeah.
Happy birthday to you.
Thank you, and you as well.
Yeah. So what did the tomato say to the other tomato during a race?
Don't
Ketchup.
spill anything? Oh,
Ketchup.
Oh, my God. Oh, my God.
What do you call a cow with two legs, Nita?
Standing up?
Lean beef.
Okay, 2 for 2. You got me. Any more?
Oh, yeah, I could do the whole show with that, but instead...
Okay, well, let's talk to our callers.
Let's get some callers in here.
Okay, all right. So let me tell you what we're doing here today is we're basically talking about orthopedic pain. And we know that 30 to 40% of Americans have musculoskeletal or orthopedic pain, long-term, sometimes for years and years and years. So Dr. Darrow is able to help you with that, in most cases, with regenerative medicine. So if you have joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, knee pain, hip pain, arthritis pain, any kind of stiff joints, dull aches, you may not really know where it's emanating from, but maybe Dr. Darrow can help you figure it out right here, right now. So give us a call right here in the studio at 866-870-5752. That's 866-870-5752. And check out the website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. Very exciting stuff. But when you call the program today, you get a free book, Dr. Darrow's latest, called Stem Cell and Platelet Therapy Regenerate, Don't Operate. It has 264 scientific studies, I counted. The foreword is written by Suzanne Summers, the actor, who's always been a supporter of yours. You two know each other and have supported each other through trying to help people find better health naturally when possible. So we're here Saturdays at 10, again at 1 p.m. And again, our number right here is 866-870-5752. You know, the hour goes quickly, Dr. Darrow. So we really urge you to call early in the program so that you don't wait in line at the end and we might miss out on you. So again, if you're just joining us, this is Living Pain Free with Dr. Marc Darrow, because we want you to live pain-free. That means not being in pain.
Let me take a question here, because this one's interesting. You know, we love your calls. It's a lot more fun to talk to live people than just answer questions. So please give me a call. And the phone number to the studio is 866-870-5752. I'll repeat it, 866-870-5752. And if you catch this show, this is live right now, but occasionally the studio will repeat it at odd times when I'm not here. And the phone number to the office, if you want to call me personally or find out more, is 800-300-9300. I'll repeat it, 800-300-9300. And you can also get a hold of me through my website. That's where a lot of these questions come in. Every single page on the website has a spot where you can email me. And the website is www.lastemcells.com. lastemcells.com. It's a website. It's got videos of me doing the procedures of regenerative medicine. That's what this field is now called. Back in the old days, we called it prolotherapy. That was injections, believe it or not, with just concentrated dextrose, which is sugar water, which would cause an inflammatory response, and the inflammation creates healing. It draws fibroblasts to the area, and tissue can regrow. So all we're doing is regrowing tissue, and subsequently to those old days, because I've been doing this a long, long time, since my residency at UCLA, and I don't know where the days went, but it sure went fast, it seems, because I have a good time doing this. We moved into the area of using platelets from your blood and using bone marrow, which has platelets and stem cells and exosomes and cytokines and a lot of different things that help you regrow tissue and heal from top of the head really to the bottom of the feet and everything in between. So, Nita, I'm going to take Steve from Burbank. He's got low back pain.
Let's go.
And, yeah, let's do it. So, Steve, how long has your back bothered you?
Oh, hi, Dr. Darrow. It's been going on for, a number of years. I'd say 2 to 5 years. I can't pinpoint exactly, but it's manageable for the most part. Here's the issue. I know you're a golfer, and you can probably relate to this. There's a lot of torque put on your lower back when you swing the club, and it usually takes me about a day or so to recover from some minor irritation after a round of golf.
Okay.
This last week, I played on Tuesday, and I'm still hurting 5 days later, and it's pretty bad this time to where if I even get up or sit down or stretch, I can almost not move to a point where it's a sharp pain, and I'm not sure if it's muscular or skeletal or what. So I wanted to see
have you been to a doctor? Have you been to a doctor? Gotten any images or any impressions?
A couple of years back, we did an X-ray, and they told me that it was just degenerative, and there's nothing I could do about it except exercise. And I try to do core exercises like planks and sit-ups and things to strengthen the muscles. But
good.
I'm not sure what happened this last week, whether I just didn't warm up properly or it's getting progressively worse.
That warm-up thing is funny. I've had so many patients come in, and they say the only time they get injured is when they warm up. It's counterintuitive. So, there's no Bible on healing and pain and all that stuff. And my experience is, as a golfer like you are, and I've ended up with horrific low back pain after playing golf and tennis and things like that, with all the pounding with tennis and, like you say, the torque with golf. And I actually had my low back injected many, many, many years ago because it was debilitating. And I haven't really had low back pain since. There's a series of attachments to the pelvis in the back, and the most common is the iliolumbar ligament. If you want to write that down and look it up, you can see where it is. ILIO lumbar, LUMBAR, ligament. And they're on both sides of the low back, right above the little dimples in your back. I don't know if you've ever seen that on somebody. And they attach from the L4 and 5 spinous process of the lower vertebrae and the lumbar vertebrae. From there, they originate there, and then they attach at the pelvis. And they go sort of deep underneath the pelvis. And it's really one of the easiest things to heal. 80% of people have that syndrome at some point in their life. I had a gentleman who had it for 50 years, 50 years, and I did one injection on him. Actually, it's one series, meaning several pokes, but only one time. And he completely healed. And I've had that experience too. Most people, it takes, with that area, 1 to 3 treatments. I'm not going to promise anybody anything. I give no guarantees, but that generally is an easy spot to fix. Okay? The other things that attach there are the thoracodorsofascia, which is like saran wrap that covers your muscles. It attaches down there. And then the quadratus lumborum muscle attaches there also. So there's a lot of action down there, a lot of things you can sprain. And I always tell people, I get people almost every single day, new people that come in with low back pain, just like you're talking about, and they've been to a surgeon who says they have to operate. We never operate on those, never. It's not needed.
I don't want to do that.
It's not the cause of the pain. And the patient goes, but I saw my MRI. I've got disc degeneration. I've got disc bulging. I've got facet arthropathy. I've got a herniated disc. All of these potential things that could cause pain. But all it takes, like I had a gentleman come in yesterday. He was 84 years old, had been an active tennis player, and just beat up his back quite a bit. And, he said he had to have surgery. He was told he had to have surgery. I had him lay face down. I touched his low back, and he screamed. Touched on both sides, and he literally screamed. Then I touched in the middle where the inner spinous ligaments were, and he screamed again. And I said, you are the perfect candidate for getting bone marrow or platelet therapy, PRP, or bone marrow stem cells. Now, the nice thing about bone marrow, it has PRP in it, because the bone marrow also makes blood, which is where we get the platelets from. So,
doctor, when I reach around and push in different areas of the lower back, I don't experience any pain. It only happens when I stretch or sit up or stand up or reach for something. Then it's like
same
a sharp
thing.
pain. So
same thing, yeah.
Okay.
You can't put the pressure on
And
that I can. You can't do what I
Okay.
can do in terms of self-testing.
Of all those things that you mentioned, how do we determine which one it might be? Do you think I should get an MRI, or is that gonna help at all?
Here's my point of view.
What
This is my point of view. I always leave it up to the patient what they want to do. If a patient says, I want an MRI, I get it. But if it's what I think it is, to me it's what we call a pathognomonic test. It means when I test that and that shows up, that's almost 100% chance that that's what it is, okay? So I don't have people get an MRI for something like that. It's expensive to get an MRI. We test it by injecting it. If they don't get better, then we might consider an MRI. The main thing is if you have leg pain or if you have neck issues, but it's really arm pain, then I think an MRI is needed, but not just localized low back pain or neck pain or thorax pain or things like that, because those we can just usually fix with, like I say, generally.
I'm thinking this is directly related to the golf swing itself. What do you think?
I'm pretty sure it is from what you're telling me, because it hurts after you swing the club. And, it's funny because I've taken I don't know how many, let's say 1,000 golf lessons. There's a lot of times when I'll take 2 a week, one from one teacher and one from another. I just love being with a teacher. And I know a lot about the swing. I'm not a good player because I can teach, but I can't do. I started golf late in life. So people that start really early when they're a kid, they have a natural golf swing. I don't. So I try to get into the positions that the pros are in, and I can't stretch into those positions. My body has gotten older and the collagen is tightened up. But there are types of swings I could show you where you're not going to torque your back, okay? And that is not
I can't swing like I used to 30 years ago, but I can still do a reasonably wide angle swing.
You know what? If you were to send me an email through the website, I'll email you back with my personal website. And if you want to attach a quick video of a swing, how long does a swing take? Not long. I'll tell you immediately how to change that so it doesn't torque your low back. Another thing is don't spend any time at the range. Just play golf.
Really?
When you play
Why
golf,
not?
because you're repetitively stretching that area. How many balls do you hit at the range?
How else do you practice though?
That's the problem. You can't practice as much if you have that unless you fix it. I think I could fix that. I'm not promising you, but from what you're telling me, I think a couple shots of your bone marrow with stem cells and platelets would fix that. Like I said, my back doesn't hurt anymore. It used to be horrific pain.
Well, that sounds very promising. I want to keep playing golf. Try to do it once a week, and there's nothing like getting outdoors and fresh air.
It is wonderful. I crave it. I crave being on a beautiful golf course. Yeah.
Yeah.
You know what? You're in Burbank. Someday after we fix your back, we'll get together. I'll take you out to Mountain Gate where I play.
Oh, I love that. Love that. Yeah, I play DeBell up in the hills.
Oh, I love DeBell. Yeah, it's a great course. Yeah. It's actually a tough course, kind of tight.
It is. It's short, but it's very tough.
Yeah. It looks like it's going to be real easy. And then the big problem is the coyotes on the first fairway. There's like 10 of them at a time.
Yeah,
there really are. I mean, and once they were all laying down, and I drove the ball right in the middle of where they were lying there, and I did not pick up that ball. I just dropped another ball.
No, that's their ball now.
Yeah, exactly. Anyway, God bless you, Steve.
Thank you,
Steve. Thanks, Doctor. I'll send you. I'll send you my email.
Yeah, and there's a great chance that we could help heal your back with regenerative medicine, platelets, and or stem cells. I have to touch it first to tell you for sure. But what you're describing is so common. You have no idea. Like I said, 80% of people get that at some point in their life. Okay?
All right. Well, that would be wonderful. I'll look forward to seeing you.
All right. Nita, take it.
Well, our number right here in the studio for your call is 866-870-5752. That's 866-870-5752. And we're going to go to Margaret in Duarte.
Hey, Margaret, your right knee hurts. How long has that been going on for?
Well, it started, Doctor, it started kind of in June. It really didn't start with the knee. I started to have sciatic pain.
Okay.
Beginning or middle of June, and then all of a sudden the sciatic pain disappeared, but then all of a sudden on my right knee I couldn't walk. I was really walking and dragging my leg, and the pain was very, very severe. I thought it was from the sciatic pain reaching down from my buttocks down to both my legs. But then, of course, the sciatic pain went away, and then the knee pain came. After finally struggling and trying to get to see a doctor, I went to a chiropractor. She worked on me twice, and then she said, I think you need to tell your primary doctor to give you an MRI. Well, when I went to my doctor, I had to talk to one of his associates. He wasn't available, and they gave me a X-ray, and they gave me some pain medication for the pain and inflammation. And then when I got the results of my X-ray, it said that I had mild degeneration on my right knee. It's not on the knee, it's on the side of the knee.
Okay.
And so I talked to the orthopedic doctor yesterday. He said for me to continue taking the meloxicam, that's the anti-inflammatory, with Tylenol. And then I asked him if he would give me an injection of prednisone, because I heard a little bit about that. And he said that he gave me two reasons that I cannot remember why he was reluctant to give me that. But he said that if I had a lot of pain, he would give me cortisone. And so I said, well, okay, then I want that, because I work in a museum. I have to be able to stand up and walk from gallery to gallery. So that's where I am right now. I don't know if getting at least a cortisone shot is the right thing for me.
Okay, so here's what I want you to do. I want you to Google the word cortisone, okay? And look at cortisone side effects. If you read that,
vitamin?
side effects, problems. If you read that, you're not going to get a cortisone shot in your knee, okay? And I'm going to tell you why. Because it destroys the cartilage and gives you arthritis. So I'm not going to tell you what to do. I'm not your doctor. If you were my patient, I would never let you get a cortisone shot. Okay? That's called traditional. That's called traditional medicine. It's the standard that they use to get rid of pain. It's the very worst thing you can do, though. the pain goes away temporarily, but then long term you've got a joint that's going to be destroyed.
Uh-huh.
Just look it up. Don't trust me. Look it up and see what the studies show.
Okay. And in the meantime, when the pain comes on, because the doctor told me basically it's something I have to live with.
That's not true.
Well, then what would be the remedies? I know they recommended physical therapy.
You can try that if you want.
Mm-hmm. And
the remedy I use is to regrow the tissue that's having a problem. The fact that you say it's on the side of the knee might mean that it has nothing to do with the knee joint. There is a lot of stuff on the side of the knee. Depending which side, there's the iliotibial band that inserts at a place called Gerdy's tubercle. There is the medial and lateral collateral ligaments. There's the meniscus. There's too many things for me to talk about that could be affecting it. I need to have you show me where the pain is. I then touch it, and I can tell you what's going on and what we can do about it. What I use to fix those issues is what's called regenerative medicine. Instead of using a steroid like cortisone and getting rid of the pain instantly and causing long-term damage, I use platelets from your blood, or I use bone marrow. And the bone marrow has platelets and stem cells and a lot of other healing things in it. And that regrows the tissue and gets rid of whatever the problem is, okay? Now, what I'm talking about is not a panacea. It doesn't work on everybody, and it doesn't fix everything. That's why I can't tell you I can help you until I examine you. To me, an MRI means zero, okay? Doctors treat based on an MRI. But we have studies in my book, Stem Cell and Platelet Therapy, which you're going to get a copy of for calling in today for free, has studies that show that you can have an MRI that looks perfect and have terrible pain, or you can have an MRI that looks terrible and have no pain. So I don't guide myself based on an MRI. Very often when someone has a bad MRI, let's say something like a tibial plateau fracture, something like I think might need surgery, I send them for a second opinion with the surgeon. The response 100% has been that patient needs to have surgery. Then I leave it up to the patient. And most of the time they don't want surgery, and we fix the problem by just injections. Injections are simple. They don't cause big issues. Surgery can cause lots of terrible issues. I've mentioned this on the show before. I had a patient who had a knee replacement, and he died 2 weeks after from a blood clot from it. I've had so many people come in after infections from surgery. It's not something I want to get on me. I had a shoulder surgery back in 1990, I'm forgetting, probably around 93, when I was in medical school, my fourth year of medical school. And my shoulder blew up like a balloon. It was all full of fluid, and I had a high temperature from it. At that point, I thought, because I always wanted to be an orthopedic surgeon, I thought, why am I going to do this to people and hurt them? And then I was able to heal my own shoulder by self-injecting it. One time, I woke up the next morning, and my shoulder was completely healed. And that was the wake-up call for me that regenerative medicine was going to be what I wanted to do. I healed my wrist with it, my shoulder, both my knees, both my elbows. I've had other people do my neck and my back, and I've been injecting myself for over 20 years because it works. It's not going to work. I'm going to say again, it's not going to work on everybody for a lot of reasons. Most of the reasons are people quit before they're healed. Hang with us, and we'll finish this up after the break.
You're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.